Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the first video of repeat revision course of endodontics, which is very important for NLE, MDS, NBD as well as for BDS students. In this video we will discuss about endodontics definition and normal anatomy of pulp cavity and its division like pulp chamber, root canal and canal orifices, and about pulp in pulp anatomy, blood supply, innervation, and function of pulp, and fibers of pulp, and simple and complex innervation of pulp. First, we start from endodontics. First word, the word endodontics mean endo mean inside, dontic mean tooth. Mean in endodontic we treat the teeth internally inside. This is the endodontics word mean. Now come to the definition of endodontics. How we define endodontics? Actually, endodontics is the branch of dentistry in which we do three things: prevention, diagnosis, treatment of pulp infections, pulp pathologies, and pathology around the root like periapical abscess, chronic abscess, granuloma. And next, we preserve the vitality of tooth. And next, if pulp is diseased, then we like pulpitis, then we treat the pulp. And finally, we restore the tooth to its form and function. And now, how we define? Endodontics is the branch of dentistry that deal with the diagnosis, treatment, and prevention of pulpal and periradicular diseases. It includes prevention of vitality of tooth, treatment of a diseased pulp, and restoration of tooth to its form and function. Now come to the pulp cavity. What is the pulp cavity? The pulp cavity is a central cavity within the tooth. Within the tooth there is a central cavity which is the pulp cavity, and this pulp cavity is entirely surrounded by dentine except the apical foramen, except the apical foramen which is on the apex of the root. Look at the diagram A. There is a apical foramen through which blood vessel nerves enter, and the pulp cavity may be divided into. We divide the pulp cavity into two. Number one is the coronal portion of pulp cavity, which is called pulp chamber, and a radicular portion which present in the root, which is known as a root canal. Now, what is root canal? Root canal is a radicular pulp. Now here look at diagram A. In pulp cavity we have root canal and pulp chamber. Then in pulp chamber we have roof of pulp chamber, floor of pulp chamber, and the projection of pulp chamber into the cusp, which is known as pulp horn. Look at diagram B. There is a apical foramen and there is the excessive apical delta, which present in apical 1/3, the tilted lateral canals. Then the orifice of this accessory canal, which is known as accessory foramen, then accessory canal, accessory foramen, apical delta, and root canal, and lateral canal. Next is the here is the different single and multi-rooted tooth views. Various views of root canal system. In A there is a labial view of central incisor. In B there is a apical third of root, and in C there is a buccal view of maxillary first molar, and in D there is a buccal view of mandibular first molar. Now we will discuss one by one these in next videos. What is the apical foramen, what is the apical delta, we will discuss all in detail. Now come to the pulp chamber detail. In anterior teeth, the pulp chamber gradually merge into the root canal and this division become indistinct. Mean in anterior teeth, the pulp chamber is merged with the root canal, mean root pulp, and it merge in that way there is no division, mean indistinct. But in multiple tooth, there is a division in multi-rooted tooth. And this division become indistinct. In multi-rooted tooth, the pulp cavity consists of a single pulp chamber and usually 3 root canal, although the number of canal can vary from 1 to 4 or more. Now, in pulp chamber, there is a, look at diagram C. In pulp chamber, there is a pulp horn, there is a wall of pulp chamber, there is a floor of pulp chamber, there is a roof of pulp chamber. And in floor of pulp chamber, there is a canal orifice, canal opening. Now come to the first roof of the pulp chamber, and the roof of the pulp chamber is there. On the roof of the pulp chamber there is a dentine layer. Now roof of the pulp chamber consists of dentine covering the pulp chamber occlusally or incisally. In anterior teeth incisally and in posterior teeth occlusally. Now next is the pulp horn. The pulp horn is the projection of pulp below the cusp. These are the pulp horn in diagram C. A pulp horn is an accentuation of the roof of the pulp chamber directly under a cusp or developmental lobe. The term refers more commonly to prolongation of pulp itself directly under a cusp. Mean the pulp is prolonged into the pulp is prolonged under the cusp. Next is the floor of the pulp. Floor of the pulp chamber run parallel to the roof and consist of dentine bonding the pulp chamber near the cervical area of the tooth, particularly dentine forming the furcation area. Mean the pulp chamber are present there. The mean pulp chamber is floor is present at the area of where cementum and enamel where cementum and enamel meet. Mean the floor of the pulp chamber run parallel to the roof and consist of dentine bonding the pulp chamber near the cervical area of the tooth, and particularly dentine forming the furcation area where tooth divide into roots. Next is the canal orifice. Canal orifice are the opening in the floor of the pulp chamber. In the floor of the pulp chamber, the canal orifice are opening which go into the root canal. These are the canal orifice. And between these are the 4 canal orifice. In between the canal orifice, there is a floor of the pulp chamber. Next, the canal orifice are the opening in the floor of the pulp chamber leading into the root canal. The canal orifice are not separate structure but are continuous with both the pulp chamber and root canal. Mean root canal and pulp chamber meet with the help of these canal orifice. The wall of the pulp chamber derive their name from the corresponding wall of the tooth surface, such as the buccal wall of a pulp chamber. The angle of a pulp chamber derive their name from the wall forming the angle, such as mesiobuccal angle of the pulp chamber. Now come to the root canals. These are the root canal. Mean root canal are the part of the pulp cavity which present in the root portion, in the radicular portion, and root canal is the pulp. How we define the root canal? The root canal is a portion of the pulp cavity from the canal orifice to the apical foramen. For convenience, it may be divided into 3 sections. Then we divide the root canal into 3 sections, namely coronal third, middle third, and apical third of the root canal. Like here, apical third, middle third, and coronal third. Next is the accessory canal or lateral canal. These are the in figure B, there is a accessory canal or lateral canal. What are these canal? Accessory canals are lateral. Canals are lateral branching of the main root canal. These are the lateral branching of the main root canal, generally occurring in the apical third or furcation area of the root. In apical third or furcation area. Next is the lateral canal is an accessory canal that branches to the lateral surface of the root and may be visible on radiograph. Next is the apical foramen. The apical foramen is the opening at the apex of the root through which nerve and blood vessel is passed. This is the apical foramen. Apical foramen is an aperture at or near the apex of the root through which blood vessel and nerve of the pulp enter or leave the pulp cavity, and veins leave the cavity, lymphatics leave the cavity, and blood vessels and nerve enter. Next is the accessory foramen. Accessory foramen, the lateral canal opening or accessory canal opening is known as accessory foramen, and the main canal opening is called apical foramen. Accessory foramen are the opening of accessory and lateral canal in the root surface. This is the accessory foramen. These are the canal orifice. This is the root canal from where we remove the pulp and we enter the file to take its length. Now come to the pulp anatomy. In pulp anatomy, the pulp anatomy have in central region of the pulp anatomy and peripheral region what structure are present. In central region of the pulp, there is cells like odontoblast, fibroblast, undifferentiated mesenchymal cell plus defense cell. Next is the matrix like collagen type 1 and 2. Third is the grown substance like glycose, aminoglycans and glycoprotein. And next is the blood vessels, and next is the nerves, means subodontogenic plexus of Rakshaw plus sensory efferent from trigeminal nerves. These are present in the central region of the pulp. But in peripheral region, there is a odontoblastic layer, cell-free layer, which also known as zone of well, and next is a cell-rich layer. And blood and nerve supply, blood supply through external carotid artery, and innervation nerve supply through trigeminal nerve branches. Next, there are two types of fibers present in the pulp. One is the A fibers, second is the C fibers. A fiber is the largest diameter and C fiber have a smallest diameter. And A fiber is the fast conducting and C fiber is the slow conducting. And A fiber is responsible for localized sharp pain in the pulp. And C fiber are responsible for dull and throbbing pain. Now, when we use the electric pulp testing in diagnosis, the A fiber gets stimulated first. As the current intensity increase, C fiber gets stimulated as well. Mean first A fiber stimulated, then C fiber. Next is the development of pulp. Pulp developed from the ectomesenchymal cell of the dental papilla. When the odontoblast form dentine, the dental papilla change into the pulp. Next, functions of pulp. There are 5 functions of pulp. Number 1 is the formation of dentine, because in the peripheral layer of the pulp there is the odontoblast which is responsible for dentine preparation. Next, maintain tooth fluid movement, because in dentinal tubules the blood supply come from the pulp. Next is the sensation. Again, in pulp there is a free nerve ending. Next is the proprioception. These receptors are also present. Next is the defense by blood supply forming reparative and secondary dentine. Next, when pulp is damaged, its capacity of repair is reduced. Then we go for root canal. Why? Because pulp have no additional blood supply, mean collateral blood supply. Pulp has minimal collateral supply which reduces its capacity for repair. This is MCQ's point. Next, innervation of pulp is both simple and complex. Simple only free nerve endings, so lack of proprioception. Complex innervation about onto blast process, which produce high level of sensitivity to thermal and chemical changes. It is complex. Mean pulp have both simple and complex innervation. Now this is all about part 1, in which we discussed about endodontics, pulp cavity in detail. In next video we will discuss next topic. Now there are more than 530 videos present on my YouTube channel, and there are separate playlists for each subject or repeat revision course. You can go and watch these videos as well. Now, if you like my video, press the like button and share this video with your friends. If you're new to my channel, subscribe my channel by pressing the red subscribe button, and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.